Hey everyone. So we're getting a lot of questions right now about how to find preceptors during this COVID pandemic. And it's such a challenging question because, um, there are a lot of students right now that are going through rotations that are really are worried about their safety. And we totally understand that. So for the students that understand that they want to go through clinicals, they don't want to delay their graduation, and they're still looking to find clinical sites. We recommend the three things that are really working for us at this time, and that's using LinkedIn and also being really empathetic with the preceptors that you're reaching out to. Now, the reason for that is some of our preceptors are incredibly busy, right? Some clinics right now are seeing patients nonstop. They're doing everything they can with helping the population that's been um, impacted by the coronavirus. And it's important to realize that response times are going to be a bit slower. So keep that in mind. We all know that our nurse practitioner students right now, they're nurses, right? So they're working their tails off right now. Some of them are put in situations where, they don't have the right equipment. We're seeing what's happening on the news. So while we need to be empathetic for our nursing community at whole, we also need to be super empathetic for our preceptor community, for our anyone that owns a clinic, anyone that's working in a clinic where you're possibly trying to precept in. When I say LinkedIn a few seconds ago, I say that because LinkedIn is really non invasive. Um, a few months ago, I would have advocated that you call them and then you use LinkedIn and then you send an email. But just given with the environment at the moment, calling people is really it's going to be really bothersome. And when you're asking for something, especially for something like a clinical site, a preceptorship, really encourage you to pause on the sort of nonstop barrage and try the LinkedIn approach, which is a great way for you to sort of nudge yourself in there, send them a long message, displaying your empathy for the situation. And the third thing I would say is really try to figure out your plan of action for the rest of the year. Now, many schools, and this is really important, talk to your school because many schools are allowing their students to double up on rotations in the fall or rotations in the summer starting in May, as opposed to continuing with your placement right now. So, if that's in fact the case, what you can do is move your current preceptorship to the following semester and then do two at a time if that's possible for you, or spread out one over the course of the year, or even in some cases, especially with psych, using telehealth, right? If you can complete your clinical rotation via telehealth, then that's even better. And if you can do that in a following semester, you can now do like double down on that, and do two rotations at once to get caught up. The goal is obviously to get students to graduate. I don't think there's enough information being talked about the number of nurse practitioner students that will have to delay graduation. I think a lot of the conversation right now is around nursing as a whole, and I think we do need to subset that down a little bit. But if you don't want to delay graduation, try LinkedIn, deploy some empathy, and please, please, please think about the rest of your year. Fall is coming, and we all expect this virus to be over, whether you think it's going to be April, May, even if it's June or July. The fact is, by September, I think there's a large understanding that we should have gone back to a fairly normal state. And please don't wait to start booking your rotations, securing your rotations, searching for rotations and preceptors for the fall. If you need us, we're accepting students for the summer and the fall right now. Please get in touch with us. Um, we are expecting there to be a crazy influx of students. All the students that have waited right now, who aren't taking clinicals, they're going to start taking two at a time, or they're all going to kind of come together in the fall. So book today, get in touch with us. We're happy to help, and I'll see you on the other side. Bye, everyone.